and good morning or good afternoon. It is noon, so whichever side of where your clock is, it's either good morning or good afternoon. So I am here today with my regular Friday lunch and learn, and hopefully this week I won't have mistakes. I had a lot of mistakes last week, so I apologize in advance. And what had happened is in the report, I had taken out all the photos and a caption got left and got inserted into a paragraph. And so I was like, what is going on? So I apologize. I've gone through this a couple times, so hopefully I won't do that again today because that's embarrassing. But you guys have been with me long enough to know that there's just a lot of transparency here. And so today we're going to be talking about ivermectin and how ivermectin is showing some real promise in treating cancer. And so you may remember that ivermectin came into the common parlance about, I guess it's 3 years ago now. And a lot of people were saying that it was really going to be helpful in the what was then the current pandemic. And it was hard to find doctors that would give you ivermectin because it was just hard. Don't know why. And so just funny story. I told my husband to go to Tractor Supply to get some ivermectin. And it was a just in case scenario, right? So I told him to go and do that. And he went to Tractor Supply at the end of his workday and he came home empty handed. And I said, did you go to Tractor Supply? And he goes, well, I did, but I don't know if we are a cow or if we are a horse. And I said, what? He said, well, I asked the guy for ivermectin and he showed me what he had and he asked me if we had a cow or a horse. I said, really? What is that about? He goes, well, a cow you give injections and a horse has a paste. I said, oh, well, we're horses. And so that's just the way that worked out. Now, you can, obviously, if you have a doctor who is enlightened, who will prescribe this for you, then you can get it in the pill form. And the thing that you have to worry about, if you are a horse, like me, I'm a horse, you have to worry about your body weight and getting the right milligrams per body weight. So there is that. There is a doctor that I know, Dr. Simon Yu. He's a medical doctor. He practices in St. Louis, Missouri. And I've been with him on multiple times, and he has written a book called The Accidental Cure. Now, he was in the military. He was a military doctor, and they sent him to some third world country. I would be lying if I told you that I remembered where he went, but he was treating all these people for parasites. And he was giving them all kinds of parasitic medications. And what he found out was that not only was he getting rid of the parasites, but he was also getting rid of cancers. And he wasn't even treating them for cancers. So there's a lot of research out there that shows that anti-parasitic herbs can have a positive effect on cancer. So we're talking today about that. And the story I want to tell you is about a gentleman who was retired, who had terminal colon cancer. He was in a lot of pain. This happened in 2020. He had a very large tumor in his rectum, and the doctors gave him about 6 months to live. Well, they didn't take that as the final answer, and so they did their research, and they decided that they were going to use ivermectin and see what it would do. So the doctors were against doing some really invasive therapy. They were against doing surgery because of his age and how far the cancer was advanced and that kind of thing. So they started him with 10 rounds of radiation therapy, and his CEA number, now the CEA number is the cancer embryo antigen. Okay, it's a bigger name than that, but you get the idea. There's a certain number that you need to be below to be considered cancer-free. And so in his particular case, he started his CEA was significantly elevated at 480 nanograms per milliliter. About a month later, he started chemo, but by then his CEA had risen to 1,498 nanograms per milliliter. So by this time, the colon cancer had metastasized and spread to his liver, where he had 25 tumors. So he and his wife decided that they were going to add ivermectin into his regimen to see what would happen. So in February 2021, he started taking the ivermectin. 10 days later, his CEA had dropped from 1,400 something to 184. That is a huge improvement, okay? In March, all right, so this is February 2021. In March 2021, his number was at 47.9. By April, it was 20.7. And then by April the 21st, it had further dropped again to 13.9. By midsummer, it had fallen into normal range. And of the 25 tumors that he had in his liver, he only had 3 left. And so that was a huge improvement just by adding the ivermectin. So he went on to live 2 more years, and then he did die of complications with those 3 tumors that were remaining. Now, I personally think that if he had just not had maybe so many chemos and radiations, that maybe he would have had a better prognosis. However, that's just the way our medical system works here in the United States. They have a standard of care protocol, which will always include chemo and radiation. Now, most of you that know me well, or you've been watching me for a long time, you know that my first husband died of cancer treatment. And whenever he was in 1998, in December of 1998, he was diagnosed with esophageal cancer. They removed the tumor. They said that it had spread to his lymph nodes. And I didn't know all that I know now about that. But anyway, they offered him chemo and radiation, and we said no. In March, they found a brain tumor, and we went into the hospital, and they offered chemo and radiation, and we said no. And he had the tumor removed in, I think it was the 1st of May in 1999. And the tumor came out brilliant. The doctor was very pleased. He said, I wished all of my patients had such a good result. He said, when we got into the skull, he said that tumor just popped out like a hard-boiled egg. So that was really good. We were really excited about that. And the doctor said, but we do think there are some more hot spots in the brain, and we want to do radiation therapy just to make sure that those don't turn into future cancers. Well, we didn't know anything, and so we said yes, and within 17 days he was dead. So, and he died of radiation poisoning. So this is kind of, I'm a little bit biased against those kind of things. So take what that is with that bias and make your own decision, pray about it, and do what you need to do. So the main thing is we did not know about ivermectin. We did not know about any holistic therapies whatsoever. And so his situation may have changed if I had known differently, if I'd been able to respond differently. However, these people knew, they took the chance, and they had 2 more years that they would not have had with just the chemo and the radiation alone. Like I said, they gave him 6 months to live. They called him dead man walking. So there are at least 9 perfectly defined cancer targets that are affected by ivermectin. Now, this is from Dr. Alfonso Gonzalez, who is an oncologist and a senior researcher at the National Autonomous University in Mexico. Now, the first reports of ivermectin having anti-cancer benefits came out in 1995. 2 French researchers found that ivermectin, a Nobel Prize-winning anti-parasitic drug, could reverse multiple drug-resistant tumors. So this is important because there are some cancers that are just very, very resistant to the traditional therapies of chemo and radiation. So the drugs target the tumor stem cells, which is a driver for cancer tumors relapsing, and it even promotes death. So ivermectin enhances the effect of chemo and radiation. It has a broad impact on the immune system, increasing the immune offense against the cancer. So this is something that if you're not really familiar with how your immune system works, if you're not familiar with how cancer works, then you're going to have to do some research here. But just suffice it to say that when you have drug-resistant tumors, if you add ivermectin to the mix, it helps those tumors respond to the medication. Ivermectin also inhibits cancer cells by preventing the formation of new cells. The drug promotes killing the cancer by inducing mitochondrial stress, and it prevents the cancer survival by preventing new blood vessel generation. So what does all that mean? So inside each little cell looks like a little circle. Not really, but kind of, sort of. Inside that is the nucleus. Inside that is your mitochondria. Now, your mitochondria is the energy of your cell to do what it needs to do. It makes ATP. It does all kinds of things to help you live and, correct everything, repair everything, and move forward. And so when you have cancer cells do not have that same kind of mechanism as far as repairing. Those cells just go rogue. So the ivermectin goes in there and it causes the mitochondria to break down, and it causes the cancer not to be able to regenerate new blood vessels, because of course cancer is growing. It's a protein. It needs more blood supply, so it just shoots out all these little tentacles. And so the ivermectin stops it from doing that. So it's really, really important to understand the way that works. Many studies have found that ivermectin has impressive potential for anti-cancer, but there are very few clinical studies. One study followed 3 children with acute myeloid leukemia, an aggressive cancer that progresses very quickly if it's not treated. After conventional chemo failed, all 3 children were put on a combination therapy with ivermectin. While all patients eventually succumbed to the disease, 2 children saw a temporary improvement in their symptoms, which was noteworthy given the cancer's rapid progression. The 3rd child had absolutely no positive response to the ivermectin. Now, I think this study is a little bit flawed because all of the children already had maximum amount of chemo to deal with this blood cancer. There may have been a different outcome if their immune system had not been so weakened by the chemo. So for those of you who don't understand how chemo works, chemo does go in and targets the cancer cells, but it also has collateral damage to your immune system. So back to my story with my husband and the brain cancer, they wanted to put him on a platinum chemotherapy. Well, I didn't know much back in that day, but I did know that platinum chemotherapy would absolutely disintegrate your immune system. And I told my husband, I said, this may be something that would work on the cancer, but it will kill your immune system. So if you get a hangnail, you will die of an infection because you will not have an immune system. And the prognosis of this chemo working was less than 25%. It was 100% that it would kill the immune system, but only 25% that it would kill the cancer. So we decided not to do that for that reason. And so everybody's going to have to look at the risk-benefit ratio to see what you need to do and help, do what you need to do. I personally, because chemo just obliterates the whole immune system, I'm not a fan of it. However, everybody has to make their own decisions and do their own research and find out what is best for them. Now, there was another study done by the Japanese doctors, and it followed 3 patients with 3 different cancers: breast cancer, bone cancer, and lung cancer. These people were on a combination of ivermectin and other drugs, including anti-cancer hormonal therapy. For 2 patients, the ivermectin was added last as a therapeutic combination, with the doctors observing impressive improvements in the symptoms. Soon after ivermectin was added, all of the symptoms were relieved. So another patient was prescribed ivermectin alongside other drugs, and after 1 treatment cycle, he could come to the clinic by himself. So he did not need a minder. He did not need any help. He was able to have enough energy that he was able to get there by himself, which is a huge improvement. If you've watched people die of cancer, if you've watched people deal with cancer, the therapies are very, very debilitating. They sap your energy. They sap your strength. They sap your will to live. They sap your emotional energy. And so for him, after just 1 treatment, to have enough of that restored that he could get to the doctor's appointment on his own is pretty impressive. So Dr. Peter Heil-Mealey, who is the chair of the immuno-oncology at the City of Hope. He is a leading researcher in the United States on ivermectin as an immunotherapeutic drug for cancer. Conventional anti-cancer therapies, such as chemo and radiation, focus on damaging the DNA of the cancer cells and killing them. We talked about that earlier, but it also kills all of your immune system. All right. Ivermectin can kill the cancer cells in a way that drives the host immune response, which we call immunogenic cell death. So what that means is the ivermectin only targets the cancer cells. It does not target the host cell. It does not target your immune system. So he found in his research that when mice with breast cancer received ivermectin, the immune cells would appear in the tumors that previously had none. This process is known as turning cold tumors hot. His research says that generally speaking, patients with hot tumors have better clinical outcomes with lower risk for recurrence, and they live longer. So there's a lot of interest in what regulates whether tumors are hot or cold. However, the tumors continue to grow in the mice given ivermectin alone, meaning that the drug by itself is not enough. Dr. Lee reasoned that ivermectin could synergize with the immune checkpoint inhibitor, it's called anti-PDI, which is an immune therapy drug. Okay, so this is a pretty new kind of way to treat cancer. It's not well known, but it works a lot better with ivermectin than without it. Once these patients that had this, the mice actually were once again infected with cancer cells. The mice whose tumors were cleared after the combination therapy no longer formed new tumors. So that means that if they used ivermectin with the other drugs, they would not have that metastatic event. So that would be very good, especially for people that are dealing with cancer, because that's one of the fears, that if you don't do what the doctor says, it's going to grow and it's going to migrate and all that kind of thing. So we don't want to do that. Ivermectin has a lot of promise for cancer, but probably not as a standalone drug, says Dr. Lee. Now, professor of urologic science at the University of British Columbia, Dr. Martin Cleve, previously tested ivermectin for its ability to inhibit the HSP27, which is a stress protein that gets released in the body after the body undergoes chemo and radiation therapy. High levels of this protein get released, and it prevents the body from responding to and recovering from cancer treatments. Well, yeah, I guess, because it's all poison. And so, it really just wears you out. So ivermectin successfully reduced that activity in the animal model. However, researchers decided not to pursue clinical trials as there was concern of potential neurotoxicity, since mice were given a dose of 10 milligrams per kilogram, which is much higher than the dose prescribed for parasitic disease. So this is a case, I think, of them throwing out the baby with the bathwater. Instead of just deciding not to do it, why don't you just reduce the dose to a more manageable dose and see what would happen? There's money to be made in cancer treatment. That is the only treatment that the FDA does not regulate, which means that is the only treatment that the doctors can charge whatever they want, and there's no regulation. So while I think that most doctors are kind and benevolent and have your best interests at heart, we've all seen those articles and television shows that had the doctor who told everybody they had cancer because he made just millions of dollars on the cancer treatments. Now, we don't want to say that all doctors are doing that. I don't think all doctors are doing that. I think most doctors are doing the best they can with what they know, and there is definitely standard of care, not taking into condition your age, your sex, your immune system, what's going on with that. And so there's all these other things that we need to deal with. And that's where holistic medicine comes in, because they look at the human being as a unique set of criteria so that you're able to work with the certain person and not overload them. So, for example, my husband was a lot larger than me because he was a man. He was bigger and he was in shape, but he was just bigger. And so what they did killed him. It would definitely have killed me because I probably would have done exactly the same thing because it is standard of care. So Dr. Lee and his team has begun a clinical trial of ivermectin combined with immunotherapy for women with metastatic breast cancer. They've also found ivermectin to be effective against other type of cancers as well. Therefore, additional patients may be included in future trials. So the interaction of the two therapies is a highly complex process dependent on timing, dosage, and drug combinations. So Dr. Lee likens this process of using multiple drugs to boost immunity to coaching a football team. He says you just don't throw all the players out there and say, just run. You have different people doing different things, and you have different sequences to try to score. And that's what we're learning about ivermectin. It's going to be a powerful drug, but the context has to be developed within the context of the other drugs. And I think that that's probably really, really smart. It's a smart way to do it. And so there's a lot of research going on for which I'm very thankful. Both of my parents have dealt with cancer, and I'm very confident that while that is a possibility, it's not going to be a big possibility because I do all the things that I need to do to keep my immune system strong. Now, I want to just kind of have a little side note here. There's a difference between boosting an immune system, as this guy says, and strengthening your immune system. So it was very interesting this week. I had a girl come in and she has an autoimmune disease, and we were talking about strengthening the immune system, working on the immune system so that it could perform what it needed to do. And she said, wait a minute, my immune system is already overactive. I don't want you to boost my immune system. And I said, no, you didn't hear me correctly. I understand what you're saying. We do not want to boost your immune system. We want to unconfuse your immune system and strengthen your immune system so it quits attacking your body and it only attacks those foreign invaders. So there's very much a difference between strengthening an immune system, which is what you do want to do. We all want to do that. That's the only way we survive, is by having a strong immune system. When something comes into our field, we want our immune system to mount those defenses, go after it, eradicate it before it causes us any kind of problems. When our immune system is not strong, then that invader can multiply and do whatever it needs to do. And then by the time we find out about it, it can be too late. You may know, you may not know that you have cancer 10 years before it can be seen on a blood test, right? So you can look for markers on your blood test that will tell you if you're trending toward that. You can look at your pH balance, because cancer will only grow in an acidic environment. And all the people that come in and they show me their blood work and they show me their urinalysis, guess what? 95% have a very acidic constitution, which means it is a breeding ground for cancer. This is why we're seeing 1 in 3 men with cancer and 1 in 2 women with cancer in their lifetimes. And so what we need to do is strengthen the immune system, balance the pH so that the environment is not conducive to cancer. So Dr. Kathleen Reddy, she is a Memorial Sloan Kettering Cancer Center breast cancer surgeon, is also interested in ivermectin after 3 patients she consulted with experienced a dramatic improvement in their conditions after taking ivermectin with other adjunctive therapeutics. First of the 3 patients had stage 4 prostate cancer. It came on abruptly, and after exhausting all possible treatments within 9 months, his doctors announced that he had 3 weeks to live. The patient started taking ivermectin along with other nutraceuticals, so that means herbs and supplements and that kind of thing. And within 2 months, 60 days, his prostate-specific antigen, PSA, which is a potential marker for prostate tumors, became negligible. Now, you may know, you may not know, but a PSA needs to be under 4 to be not problematic. If it's over 4, that indicates that it could be cancer. Now, recent research in the last 5 years has come out and said us relying on PSA is really not fair to the men because they can have a high PSA for other reasons. However, we still don't want the PSA to be over 4. So we want to deal with that. And it's not always cancer for sure, but we definitely want to get it down in the normal range. So he was able, by taking ivermectin and herbs and supplements, he was able to get his number in normal range within 60 days. Within 6 months, the metastatic lesions began to disappear, and in less than a year, he was out dancing for 4 hours, 3 nights a week. So this is according to his doctor, which is absolutely amazing. Now, one of the things you need to understand, if you're trying to heal from cancer holistically, it can take 3 years in order for you to be cancer-free. Now, I have this information from Dr. Tony Jimenez at Hope for Cancer Institute, and he is one of the Truth About Cancer docs. So if you watch that series, you'll be familiar with him. I know him personally, and he treated my mom. And he says that part of the problem is people don't give their bodies time to respond, and then they rush into the allopathic standard of care, and that's where they get in trouble. So the same scenario happened with the other 2 patients. And she says, I've been a cancer surgeon for 30 years. I've never seen anything like this in one patient, let alone 3 in a row. So she is currently recruiting for an observational study on the effects of alternative cancer treatments. This is an observable study, which means the patient is able to control what's going on. But she obviously wants you to do ivermectin and whatever other things that you want to do. And she wants to see what kind of what happens and how the cancer responds. Some doctors are seeing the benefit of ivermectin, and they're adding it to their cancer protocol. Now, Dr. Gonzalez, who we mentioned earlier, he has a cancer clinic, and he does prescribe ivermectin. Now, remember, he's in Mexico, so he can do things a little bit differently than we do. Most of his patients also received chemotherapy treatments and saw reductions in their tumor markers after going on ivermectin. So Scott Rollins, who is at the Integrative Medical Center in Western Colorado, has been treating cancer patients with alternative therapies for decades. Since what happened in 2020, he has added ivermectin to the protocol after learning about its anti-cancer effects. But since patients are given a combination of drugs, he's not sure if it is the ivermectin by itself or if it is the combination. So we need to have more studies on that. So ivermectin has been shown to have some degree of anti-cancer activity on every cancer type it has been tested on. Dr. Gonzalez's research has shown at least 26 different cancer cell lines, including prostate, kidney, esophageal, breast, ovarian, lung, glioblastoma, stomach, colon, liver, lymphoma, uterus, pancreas, and the bladder all respond to ivermectin in laboratory studies. So this is very, very exciting. If you have cancer in your family, if you're afraid of cancer, if you are dealing with cancer, it may be a good idea to talk to your doctor about adding ivermectin to your therapeutic regimen. Or you could just pretend like you're a horse and you could go down to Tractor Supply and get the paste. And if you need help on weight dosage, then we can help you with that. So this is a really exciting report for me because nobody wants cancer. With all of the mutations in our food and our water and our air supply and all the things that we all deal with, and we're all going to deal with them until we, move to the Garden of Eden, wherever that is, right? We can do what we can do to protect ourselves. And so this is information that I hope you found helpful, that I hope you found exciting. I certainly found it exciting. And I appreciate you joining me. My time is up. It is the weekend. Relax, restore, replenish, especially you in the Houston, Kingwood, Humble, Atascocita area. We have had tons and tons and tons of rain in the last 2 days. And so I know people have PTSD about rain and flooding and that kind of thing. Hopefully you are good. You are high and dry. We definitely are sending out our prayers. We've been praying for all the people. I have family members that have been affected by the rains. And so it's something that is very much on my heart. And we are praying for you. We are sending you lots of positive energy so that you can have the strength to bear up and do what you need to do. And so just know that people care about you. People are praying for you. And if we can help in any way, reach out. And I will see you next Friday. Take care.